Does ice help sciatica? In this video, I'll tell you if ice has a role to play in managing sciatica. Hi, I'm David Fitzgerald, Chartered Physiotherapist, specialising in managing low back pain for over 30 years. If this is the first time you've seen our videos, please subscribe to the channel to get regular weekly updates and health tips related to physiotherapy. Every week in clinic we get patients asking us, should I use ice to help my sciatica? The first thing to say is that ice is an anti-inflammatory, and in most causes of sciatica there is an inflammatory component. So on the face of it, ice would seem to make sense because it will facilitate a anti-inflammatory effect. The way it does this is by causing what's called vasoconstriction. So the ice makes the blood vessels contract and narrow, and when that happens, less blood flow goes to an area. And when something is inflamed and damaged, generally you want to reduce the amount of blood flow to an area in the acute phase to stop any more bleeding or any extra fluid formation that is part of the inflammatory process. So on the face of it, it would appear that applying ice would be a worthwhile thing to do in cases of sciatica, but there are a few other key points to bear in mind, and I'll share those with you now. First, the sciatic nerve is deep within the spine, so you will recall from our previous discussions that in real life we have layers of muscles which would be a couple of inches deep, and then we have ligaments and bones in the back portion of the spine, and then underneath those bony elements you have the actual intervertebral disc and the sciatic nerve. So the tissues that are inflamed are quite deep below the surface of the skin, and a lot of hard rigid structures in between. So that means that applying ice can be very hard to get the temperature to actually reduce that deep down into the tissues. The other thing to mention is that usually when the sciatic nerve is sore, there will be protective muscle spasm around the area, and usually when you apply ice, particularly in the spine, you'll get a temporary increase in muscle spasm, so that can cause a bit of a shock to the system. So that more so occurs in the spine than in other body regions, so that's just another factor to consider. However, there is a positive effect of ice in that it generally numbs the skin over the area. Now, although the skin isn't really part of the problem, sometimes if you do numb the skin, it has a beneficial effect of confusing the brain, and it reduces the severity of the main cause of pain. Now, usually in sciatic pain, the pain is quite severe. Nerve pain, if you haven't experienced it, if you've ever had a sensitive tooth and felt what it's like to have ice cream or hot tea on it, you get this sharp shooting kind of a pain. That's a good example of a nerve pain, and sciatic pain tends to be that level of intensity multiplied many times and many times over. So usually the kind of effect that ice would have on the skin usually isn't sufficiently strong enough to counter the effects of it. So there's definitely no dangers or no harm in applying ice. The question is, do you get any practical benefit? And it might feel temporarily better, but it's really unlikely to have a key role in any serious management of self-management of sciatic pain. In summary, there's probably more potential benefit of ice than heat in an acute sciatic situation, but both of them are not particularly potent tools, and whilst it might be tempting to trial them, the likelihood of them having any significant difference in acute sciatic pain is pretty minimal. So although you might feel like you're trying to help the process, you're probably just better off trying to avoid activities which provoke the nerve, and my suggestion would be to use more potent anti-inflammatory measures, which would be either oral or prescription anti-inflammatories from your GP. I hope you enjoyed the video. Please give us a thumbs up if you haven't done so already, and don't forget to subscribe to the channel if you haven't done that too. If you have any comments, please feel free to post them in the section below. We'll do our best to answer them, and I'll see you again on another video. Bye for now.